Oh, hello Mom. Elena was hospitalized. Hi Jack, do you know about Caisson disease?
Yes, I am. I just learned it on pathology subject last week. Why?
It's about my sister, Elena. She fainted after diving for quite a long time at beach. My mother told me just now. Mother told me it is the effect of Caisson disease. Could you tell me what is actually Caisson disease?
I'm sorry for your sister. Caisson disease is a result from bubbles growing in tissue and causing local damage. It's caused by reduction in the ambient pressure surrounding a body. A good example is what happens to your sister when she is surfacing after a dive. During a dive, the body tissues absorb nitrogen from the breathing gas. When the pressure is reduced too quickly, that is when surfacing up, the nitrogen comes out of solution and forms bubbles in the tissues and bloodstream.
What happened if there is a high level of bubbles?
When high levels of bubbles occur, complex reactions can take place in the body, usually in the spinal cord or brain. Someone may get numbness, paralyses, and disorders of higher cerebral function.
Oh really? Is it really harmful? Can you tell me more how this happened? Because I don't know what exactly happened to Elena. I just know that she is being hospitalized now.
Let's ask my pathology's lecturer. Hello Miss Shahira. Sorry for disturbing you. Could you explain to us about the mechanism of Caisson disease?
Ooh. Sure Jack. Why not? You already know what is Caisson disease, right? Let's proceed to the mechanism. Henry's and Dalton's laws predict that, as the diver descends, excess nitrogen will enter the blood and all body tissue. These laws also predict that, on ascent, as ambient pressure decreases, the extra nitrogen that accumulated will diffuse out of the tissues and into the circulation. Caisson disease arises when excess nitrogen leaving tissue forms bubbles large enough to cause symptoms. The nitrogen is from the diver's breathing tank.
The bubble size is important. Small bubbles can often be found in divers with no symptoms. Large bubbles within tissues and the circulation causes symptoms of Caisson disease. The nitrogen bubbles being released and blocking blood flow and disrupting blood vessels and nerves by striking or tearing them. They may also cause emboli, blood coagulation and the release of vasoactive compounds.
As the pressure due to nitrogen increases, more nitrogen dissolves into the tissues. The longer Elena remains at depth, the more nitrogen dissolves in her body.
Yeah, that's true, Alex. I feel sorry for Elena. Let me illustrate this bubble formation process with a bottle of carbonated soda.
Before that, let's go to the canteen and have a drink.
Yeah. Let's go. I will treat you, Jack, Alex. Don't worry too much, Alex. Elena will be fine. Have a sit and let's continue our discussion. A bottle of carbonated soda is filled with gas, carbon dioxide, which cannot be seen because it is dissolved in solution, under pressure. When the bottle is opened, the pressure is released and the gas leaves the solution in the form of bubble.
Diver returning to the surface is similar to opening of the bottle of soda. When Elena swims to the surface, the pressure due to nitrogen decreases. The nitrogen, which is dissolved in tissues, wants again to leave, because the body can hold only a certain amount based on that nitrogen pressure.
Yep. That's true, Jack.
Poor my sister. What are the effects of Caisson disease, Miss Shahara?
Caisson disease has two types that are type 1 and 2. Type 1 is the least serious form of Caisson disease. It involves only pain in the body. For instance, the cutaneous Caisson disease. It happened when the nitrogen bubbles come out of solution in skin capillaries. The skin of shoulder and chest will turn to red rush.
So what about the type 2?
Type 2 is the most serious and can be immediately life-threatening. Normally it affects the nervous system. For example, the neurological Caisson disease. It happened when nitrogen bubbles affect the nervous system and cause problems throughout the body. Type 2 normally shows as numbness, respiratory problems and unconsciousness.
Both of the types seems to be dangerous for the divers.
May I know what is the most obvious symptoms forms of Caisson disease?
It is extreme tiredness. Diver could get the sickness in the inner ear, hearing loss, dizziness, and ringing of the ears. These are clearly seen after the diver surfacing the water.
I wonder how my beloved sister went through all of these. She is the only sister I have. Thank you really much, Miss Shahara. At least, I get to know my sister suffering.
Don't worry, Alex. She'll be fine. Let's hope she was given quick treatment. Students, let's review again about the mechanism of Caisson disease. The number of divers suffer from Caisson disease was increasing because most of the divers downplayed the causes of this disease. Caisson disease is an illness caused by the formation of nitrogen gases in the tissue due to certain decrease in certain ambient pressure. Red blood cells carry oxygen to the body cells. But, when the diver ascends too fast, nitrogen is off gas faster than your body can eliminate it. Bubbles are formed in the body and this leads to Caisson disease. Minor Caisson disease can be treated by breathing 100% oxygen from a cylinder. Hyperbaric oxygen therapy may be needed in more serious cases.
Hello, it's me, Alex, Jack and Miss Shahara. I would like to thank everyone involved in making this video. I have great knowledge about Caisson disease now. I hope that you guys could learn better about Caisson disease through this video.
Yeah. Until next time. Bye bye. I love pathology.